help your body to get the energy. The cells are going to be open. Think about insulin like the key. The key that's going to be opening the cells for you to get all the glucose in and have the energy. That's usually the way I explain to my patients. Okay, so diabetes occurs when one of the following parts happens. When the pancreas does not produce any insulin, when the pancreas produces just a little bit of insulin, and when the body does not respond to insulin. That is also called insulin resistance. Okay? So diabetes, there is a myth that diabetes is not affecting anyone, that diabetes is under control. That's actually not true. Diabetes is a very serious disease. Diabetes is a growing epidemic with devastating physical, emotional, and financial issues in our country, in the United States. And not just in the United States, unfortunately it's also happening around the world, okay? So, diabetes is a public health problem that we need to learn to stop. And we have to be creative as medical professionals, okay? And to start to be creative and empower others, we need to learn to empower ourselves. That means learning to eat, learning to exercise, learning to take care of yourselves. We cannot preach something that we are not actually incorporating into our lives. Sounds good? All right, the number of Americans diagnosed with diabetes has doubled from 1980s to 2002. And it's projected that more than 300 million people globally are going to be affected by diabetes by 2025. So what do you think about those numbers?
Horrible.
Are quite scary, right? So diabetes in the United States is the 7th leading cause of death. And if you want to talk about numbers and money speaks, we're spending around $245 billion in medical costs and lost productivity each year. And I'm saying we are, all of us, because if you pay taxes, you are also paying for those expenses. So once again, it's $245 billion in medical costs and loss of productivity each year. Okay? So the CDC, the Center for Disease Control and Prevention, actually projects that by 2050, we want to be having 3 of the United States adults here is going to be having diabetes. Did I say right? No, it's 1 in 3. Excuse me. 1 in 3 of every American is going to be having diabetes. So that's a lot. So how many Americans do you think have diabetes currently? Of 20 people, how many do you think that are? 19? That would be a lot, and we will be in a lot of trouble. No, it's an epidemic, and it's growing. Imagine otherwise, 19. So that would be super scary, and probably we will be like in serious issues. No, diabetes affects over 30 million here in the United States, children and adults. Okay?
1 in 11.
So it's 1 in 11, exactly. Yeah, but this actually is kind of sad because when, let's see, 10 years ago, I was doing some similar presentation and it said 1 in 16, and now it's 1 in 11. So that's pretty scary, right? So 84 million Americans have pre-diabetes. What is pre-diabetes?
Your sugar levels
Between 100 to 125.
2 hours after you eat. Anything over, they're saying now, they've dropped the allocation, but it used to be, in the olden days when I was in the office, it was 120.
100 to 125.
It's not 125, but depending how you are actually testing a patient, it could be with the A1C, and it could be between.
A1C is also very important that we
didn't have.
in the olden days.
Yeah. Well,
Days
actually,
of yore.
no. I'm in this business as I was 17 years old, and I remember when I started to study, we didn't have the A1C. And everyone was cheating,
Yeah.
because as soon as you come into the office, you wouldn't eat, we will poke you in the finger
Yes.
and 75. Oh, you're perfect. You're wonderful.
What?
That was back in the old days. And I'm not that old, by the way. Anyway, going back. So yes, and we are not that old either. So 84 million of people are at risk of prediabetes. Okay, and 90 of them don't know that they have it. So every 21 seconds, someone in the United States is diagnosed with diabetes. So what do you think? Do you think it's a problem that we can take, like, lightly?
No.
Yeah, it's a big issue. All right. And as you mentioned earlier, depending on the ethnicity or the race, I don't really like to use the word race, but okay. Depending on ethnicity, African Americans and Hispanics, we're at higher risk. Okay? 50% of the cases, we have higher risk to develop diabetes than non-Hispanic whites. And it's a problem because if we don't take care of our diabetes, there are a lot of complications related. Stroke, blindness, kidney disease, heart disease, loss of toes, feet, as you mentioned, with your relative, or legs, okay? And most people living with diabetes are going to have type 2 diabetes, okay? So of 90, to be conservative, we will say 85% of the worldwide population that are living with diabetes are going to be living with diabetes type 2. Okay? Just a teeny tiny fraction are going to be having diabetes type 1 or other kinds. Okay? You're following me? Okay, good. And the reason is because obesity and physical inactivity. Raise your hand if you walk 30 minutes every day. Good for you. 20. 20. 15. Okay.
4 or 5 times a week, 30 minutes.
Yeah, that's good.
Does
Very
running
good.
your mouth count?
I wish.
Depends on if you have to move your hands like
All
that.
right. So maybe it's something that you need to ask yourself. Of course, we need to be asking that to our patients and engaging them to pursue a healthier lifestyle, but also with ourselves. Practicing some self-care can help us to also help others. Good. So types. Type 1, type 2, gestational diabetes, and others. That's what we're going to be reviewing today. This is my picture. Please don't be so hard on my picture. I know it's very, very cute, but it's the way that I explain to my patients. Basically like that, right? So you eat something, it goes into your stomach, then you go through your intestine, and the pancreas is going to release insulin. And the insulin is going to be like a key that is going to be opening every cell, and then the glucose comes in. So that's a very simple way to say it, right? We're not going to be talking about other insulins and other hormones, other mechanisms. It's just a very simple way to explain to your patients. That's what's happening, But you don't need to use all the medical terminology for actually sending a good message to your patients, okay? So, but if we want to get all fancy and use all the terminology, okay, the beta cells and the alpha cells are located in where? The pancreas. There you go. And basically, they're going to be working together to make sure that the pancreas and the liver are in communication to segregate glucose, just to help with the glucose in your body. So the beta cells make enough insulin to balance the glucose released from the liver, okay? And basically, the insulin is going to be processed here. It's going to open the cells, the receptors, and basically the glucose that is coming from your liver or from food is going to be into your bloodstream, and then you're going to have energy. So, diabetes type 1, what happens with diabetes type 1? Anyone? What happens, what is the mechanism for developing type 1 diabetes?
You lose the
Onward
ability to
pancreas.
produce insulin.
Yeah, so your pancreas needs to produce insulin. And what happens in type 1 diabetes?
It doesn't.
It doesn't. There you go. Exactly. It doesn't. And what is the typical patient that you see with this kind of disease?
Children.
Exactly, usually children. And so typically it's your patient that is around 7 years old, that is rushing into the ER, has dehydration, is unconscious, and the mom says that he's been losing a lot of weight, and then you do all your tests and you could find out, that the patient is actually having
Diabetic seizure.
diabetes type 1 because it's going to need insulin. So the treatment is that because the pancreas, if it doesn't produce insulin, you're going to need insulin. Okay? So again, it's a very small fraction of patients that you're going to be seeing with type 1 diabetes, or all the diabetes. Mostly we're going to be focusing on diabetes type 1. But type 2 because it's what is happening because it's related to being overweight, the way that we're eating, also the lack of exercise. All right. And my computer is frozen. Oh, there you go. Okay, now we're going to be talking about gestational diabetes. Oh. I don't know what happened. There you go.
You got it?
I got it.
Okay.
Perfect. All right, so gestational diabetes. What do you know about gestational diabetes?
It happens while you're pregnant.
Exactly. That's an excellent answer. Yes, it happens when you are pregnant, but why? Why? What's going on in your body for you to develop diabetes?
Weight gain.
Yeah, but you're supposed to. Right?
Yeah.
And you better not tell your wife she's gained too much weight.
No, of course not.
So gestational diabetes, usually when you are at the doctor, when you are pregnant, the doctor is going to say, well, I'm going to send you to have this disgusting drink, the orange, and you need to drink it, and they're going to test you. Yes?
My concern with that automatic decision to send them for the disgusting orange drink is that my daughter had had extreme bypass surgery a few years before. And she said, I don't want that. I cannot tolerate the sugar no matter what you're going to tell me that it's going to. And they wouldn't listen to her. And she had a real hard, she down on the floor after she was literally forced to drink this stuff. And I just stepped in and said, you call right now and get 911 here and take her into the hospital because she cannot tolerate what you're doing to her system. And I have a hard time just about, even though she had said, I can't tolerate this.
And your comment actually makes me think that, remember, we have to follow some guidelines when we're taking care of a patient. However, is always the treatment, the testing of a patient must be individualized.
Right, indeed. Thank you. Thank you for that.
Yeah. There are other tests that you can do, but yeah, usually the easiest way is to screen someone is with these. I hated it. It was awful.
Nasty.
But I was pregnant. It's nasty, but you go into the lab, they take the blood sample, then you stay there 30 minutes after, you're drinking that orange juice, and 3 times. They need to be checking like every half an hour or hourly to see if how your body is reacting. Basically, how your pancreas is handling that amount of sugar. The reason for gestational diabetes is because the placenta is producing a lot of hormones. So that this could produce a resistance when you are trying to metabolize the insulin. Okay? That doesn't mean that before you were diabetic, that you were diabetic before conceiving, or that you're gonna end up being diabetic after you deliver your baby. It's just sometimes it's genetics. It's also the physiology of our body to be under a lot of stress while we are pregnant, okay? However, women that have gestational diabetes, unfortunately, are at higher risk to develop diabetes. Yeah.
Do you subscribe to the theory that women that deliver children, babies,
Mm-hmm.
that are 9 pounds or over
Mm-hmm.
have even a greater, at some point,
Risk to develop diabetes?
yes.
That's an excellent question, and I'll tell you that yes and no. Yes, because if you are a small woman like me, okay, and I have a big baby, that means that probably, yes, I'm going to develop diabetes.
Okay.
But if I'm a big woman, you know, a tall woman,
Mhm.
I'm like Nordic, that I'm not. And I have a baby like 9 pounds, no, it's genetic, it's normal, it's gonna be totally fine.
Thank you.
You know, but like me, like Latina, yes.
I have a sister who's had like 3 pregnancies. All of them were gestational diabetes.
Mm-hmm.
She has not herself yet developed diabetes or anything like that, but she's had to have the cesarean done like scheduled ahead of time every time. So.
Yeah, so my recommendation for her is actually visiting the provider every year for having an A1C, just to make sure that she's not developing pre-diabetes, because that puts her in a really high risk. Okay, perfect, wonderful. This is perfect because I'm gonna move to, oh, excuse me, the other types of diabetes. I don't know what's going on.
Has a mind of its own.
There you go. Okay, so other type of diabetes, I'm not going to focus so much on this, but they're going to represent 1 to 5%, okay? And one of them is the new one, the 1.5 diabetes. Are you familiar with this one?
No.
No? This one's actually super cool, and I'm more than happy to come back and tell you more. Not tonight, because we have a lot to cover, but it's the autoimmune diabetes that is going to manifest in adulthood, and is known as 1.5 diabetes or double diabetes or LADA, latent autoimmune diabetes in adults. And basically, it's going to be for those patients that are skinny, are not overweight or obese, they're usually skinny, and they're starting to have some problems with the beta cells. The production of insulin is limited. And sometimes physicians are missing the diagnosis, and automatically they call them type 2 diabetes, when in reality it's 1.5. But we can talk about that in another situation, in another occasion, or if you want, you can read more about it. But this is a very teeny tiny fraction of the patients that you're going to be seeing. All right, so now focus on what we want, type 2 diabetes. So once again, with my little raw. But there you go. So basically, as you know, so the insulin is not going to be working okay, or simply it's going to be very teeny tiny insulin in your system. So whatever you eat is going to spike your sugar, but specifically carbohydrates. Like what kind of carbohydrates?
Breads.
Like what?
Pasta.
Breads.
Rice? Did you say rice?
Breads.
Oh yeah, breads. Yeah.
Pasta.
Pasta. But what kind of pasta? All the pastas are bad?
No, white.
White pasta.
Yeah.
Okay.
Oh.
Bread. What about bread? Yeah, as you
White
say.
bread.
Yeah, white bread. All right. Rice. Do you think the rice is gonna spike your sugar? Raise your sugar? Yeah, rice.
Really?
Yeah.
What about brown rice?
Brown rice not so much, but it's
Okay.
going to. It's
Okay.
going to. Yeah. What about quinoa? You know quinoa,
We
quinoa.
don't eat brown rice.
A little bit.
Do you know quinoa?
Yeah.
Yes.
Quinoa is not going to spike your sugar that much.
We
Okay,
love
but rice, like white rice, white bread, white pasta, that's gonna. What about
White.
potatoes?
Oh.
Potatoes have
What about sweet potatoes?
No.
Not so much. Sweet potatoes are really high in fiber, and fiber is gonna help you to
It's one of
develop.
the better values
So-
at the supermarket.
Is there a place where we can find a list of which carbs are better than other carbs?
Yeah,
Which
you-
ones spark?
Absolutely, yeah. Remember the glycemic index? Yeah, like low glycemic index versus high glycemic index. Basically what it is what is going to spike your sugar. You know, if it's a high glycemic index, that's going to be spiking your sugar really bad. If it's low, it's going to help you. And yes, you can visit the American Diabetes Association website. They have a list where you can find. Or I can share it with Gladys, and Gladys can share it with you.
Nice.
Okay? All right, so risk factors, as we were talking, being overweight, no having physical activity, genetics, personal history of gestational diabetes, having some issues with your blood pressure, hypertension, high cholesterol, ethnicity or race, age. What other? What else do you think that can be a risk factor?
Men.
Gender?
Yeah.
Yeah? Mm-hmm. Gender, yeah. So if you're a female, you have more chances to develop diabetes.
Oh.
Why?
Gestational and.
There you go. Yeah, because we have, you know, a higher period, or well, like a longer period to be at risk, and that's pregnancy. Yeah. And what else? Menopause.
Oh.
Yeah, because what happens when we are in menopause? The estrogens, remember what happened with estrogens? No? The estrogens go,
Yeah.
Yeah.
okay, and what happened to our weight?
Oh, goes up.
Goes up.
Well.
Yeah.
Right? So estrogens are important for us actually to metabolize the fat. Okay? So the estrogens, when they're going down, our metabolism is also going down, and then we have a tendency of having more weight.
Yeah.
So yeah, gender. Yeah, I know.
And does your body shape kind of indicate some of that? I mean, I'm sorry, those of us of a lovely.
What do you think, ladies and
I do this.
yeah? Do you think?
If it's more
Yeah.
center versus.
Actually, yes.
Yeah.
Yeah,
okay.
excellent. Yes,
Yeah.
you gave me the answer.
Yeah.
There you go. So the way they're going to be carried here, you know,
Yes.
like in the apple, the apple
Yes,
shape,
yeah,
it's not going to affect me so
No,
much because the
but-
fat is here. So it's,
but-
the
the pear shape.
but the pear shape, that you know, is gonna be my weight here, and it's gonna be close to my heart. You know. So the fat is going to be close to my heart, and it's going to have like, just, how can I explain this? Just because I'm going to have the fat here, it could also cause problems when I'm trying to sleep. Why? Because if I'm going to go lying down, what's going to happen? Probably going to end up snoring, right? And I'm not going to be able to have all the oxygen that I need in my body, right? And probably in the morning I'm going to be all sleepy. And if I'm sleepy, I'm not going to have the right mindset to eat healthy, you know, or go for a walk. So sleeping is so important. It's so important that you tell this to your patients, you know. Sleeping is very important for you to have a balance. And it's like a negative cycle. If you don't sleep well, you gain weight. All right? And if you're gaining weight, you don't sleep well. All right, perfect. So where are the
A darn good thing.
Not always.
So no. It's common symptoms: frequent urination, rapid weight loss, extreme fatigue, and increased thirst. And it makes sense, right? If you're not getting energy into the cell, what's gonna happen? You're gonna be
Tired.
all the time fatigued and tired and grumpy. And yeah, of course, because you are not having enough energy into your body. So let's talk about insulin resistance, okay? But so far, are we doing good? Or do you need a stretch? No?
No,
We're good?
we're good.
Okay, awesome. So bear with me, because we still 25 minutes to go. Insulin resistance is a part of the syndrome syndrome of abnormal metabolic functioning. Okay, another way, an easy way to say it, metabolic syndrome. What is the metabolic syndrome? No? Have you ever heard of metabolic syndrome?
I can't remember.
The metabolic syndrome is pretty much, it's a syndrome. That means that they're different. It's like a package of diseases or illnesses that basically there's gonna be issues with your lipids, issues with your blood pressure, and obesity. And all of this is because of what? Your lifestyle, right? If you are not exercising, if you are not eating healthy, you're then gonna have more probabilities to develop issues with your lipids, issues with your blood pressure, and have more tendency to gain weight. That doesn't mean that we cannot change what we're doing. It takes time, it takes a lot of courage, but you as AAMAs have a wonderful opportunity to encourage your patients, to adopt a healthy lifestyle. All right? So, because of this, your whole system is going to be affected. Your macrovascular and your microvascular health is going to be affected. That means, these are kind of fancy words. In other words, simple words, your whole body is going to be affected. Your eyes are going to be affected, your heart is going to be affected, your kidneys are going to be affected, your liver is going to be affected, your feet, your nerves, everything. And when I talk to my patients, I give them an example that is kind of gross, but I think that is good because they keep it present.